Hello, everyone. We are so excited for today's session. You have no clue that you really got a gem for this session. We are so happy to introduce our dear friend Mahima Gulati. And like, she is a wonderful doctor you can ever meet. Like, not only for the brains, but her compassionate nature as well. Like, she is certified, like a both certified internal medicine doctor and also both certified in endocrinology, and a double whammy. Like, she's also both certified in lifestyle medicine. Like, you would rarely get a doctor who has so much knowledge about lifestyle medicine, and like who really treats patient like in the holistic perspective. So like today, like we are really lucky to have her, and like we can't wait to have a wonderful conversation. And I know you all have a lot of questions, and given her background, like as we said, like not only she's a board certified doctor, but she has also authored multiple papers on reproductive hormonal disorders in women and men. So like just if you have any questions, so feel free to ask. And as we said, like nowadays, it's very rare to find a doctor like who can give you advice on like how the disease, like who can treat the cause of the disease rather than just taking care of the symptoms. And I know like we'll let Mahima speak about her background, but so welcome, Mahima, and we are so excited to have you. Like we do have a very interesting question. Like I mean, nowadays, as you can see, like it's so common, like for doctors to be trained in a particular way. What actually made you to, I mean, explore lifestyle medicine or like even get into this?
So first of all, I have to thank Dr. Shobha Raipuri for her very, very kind introduction. I'm not at all deserving of that. I can tell you that. I was just looking at your face and I was like, oh my God, this lady, she's so filled with love, right? And you guys are my mentors. You guys are my role models. You know, I really have learned so much from you in the last, I think, 1 year since I've known you. And it's my good luck that I got to meet you. And your gift of health has just, been a blessing for all of my household, my husband, me, my children. So I really am really, very grateful to you guys, first of all.
Thank you
And
so much.
yeah, I can't have enough words to tell you how much I've learned from you and how much I continue to learn from you guys. Even though you guys don't engage directly on platforms, but I always keep reading, your website and your posts, and I always learn from them.
Oh, thank you.
So my foray into lifestyle medicine was, like most of the doctors in our lifestyle medicine community, I had my second baby 4 years ago. And, I went part-time at work, I don't know if you know, but in the US, there's a big crisis of burnout. The word is burnout, which is now it's got a World Health Organization definition that, people are burning out at their jobs. But doctors are burning out at a crazy rate, at a very alarming rate. 50 to 80% of doctors in the US are burnt out. And maybe I was starting to get like that in my practice, even though I was working only part-time. So my husband, who is, a big champion for me, he's my, philosopher, mentor, guide, friend. He said to me that, maybe I should do some kind of a leadership conference at Harvard. This was like this really famous women's leader conference, healthcare leaders from all across the country come there. And I was not in the leadership mode back then. I'm like, okay, I don't feel like a leader, but, okay, I'll go and try it out. And he kind of like really urged me. So I went there. And there I saw Dr. Beth Frades, who is, the president-elect of American College of Lifestyle Medicine. And I was surprised that she was hula hooping in her, blazer and her suit. And all the while she was, doing a lecture with the women executives there. And I was like, okay. But the thing, I mean, anybody can wear a suit and do hula hooping, right? But the thing that struck me was she was having so much fun. She was actually happy doing her job, right? And I was like, okay, so what is she doing that, I'm not happy at work. When I go to work, I feel like there is this paperwork and, this is, I just feel burnt out. But she's enjoying, she's having fun. She seems to be like, oh, I can't go to work. I wait to go to work, right? And then I heard her mention the words lifestyle medicine. And I'm like, okay, I've never heard of that. I've been an endocrinologist for like 13 years. I don't know this lifestyle medicine. How come I've been living in the dark? And from there on, I was like completely determined. I'm going to find out about this. I went online, I checked out American College of Lifestyle Medicine and read about the boards. And so that's basically the story. I think it was the antidote to my burnout. I found lifestyle medicine. I found friends like you guys. I took the boards. I realized how much I don't know. And, it turns out learning, being engaged in something productive is the cure for burnout. The cure for burnout is engagement. And I feel like now I don't dread going into a patient room and, not being able to treat them, right? Because, all I was doing is increasing their insulin dose. Now every patient I meet, I have a, like a chance to actually get down to the weeds and actually discuss with them what we can do, right? And so now I don't dread my work week. I don't dread Monday. I'm now back to work full time.
That's
So that's
amazing.
my
Yeah.
story.
It's amazing. Like, we see so much burnout in our physician friends, isn't it? Like, and thanks for sharing that. And there are many reasons for burnout, but one reason for burnout we see is, as you shared, like, we go into this profession to contribute and to help, but now uh, we start practicing, and at some point we realize, hey, what we're doing, this giving them medications and insulin injections or whatever, it's most of the time we're just treating the symptoms rather than addressing the cause of the problem. So congratulations to you for waking up and getting into lifestyle medicine. So you mentioned that before you were increasing the doses of insulin. Like, could you tell us, like, what do you do now? Like, when you see these patients, how is your approach to
Yeah,
your
so
patients now?
yeah.
So, back then I really didn't know much about diet. In fact, actually, I dismissed Beth Freitas's lecture when she was there at the leadership. I was like, I'm not here to learn about that. I know what else she's going to teach me. I'm an endocrinologist. And I thought I knew everything about nutrition, right? And then when I finally discovered it, I'm like, what? It was insane how much I didn't know. I mean, our knowledge is very limited and finite, but our ignorance is boundless.
That
And
is so true. Yeah. And every minute we suffer what we don't know.
I know, right? It's like, our circle, we are inside, and then everything outside is, like basically what, that's our ignorance, our
Yes.
immunity.
And
So
unfortunately, in our
go ahead.
unfortunately, in our teaching and, like, bringing up in medicine, somehow we feel like when we come out, we know
Yeah.
pretty much
Yeah, we're
everything.
experts. We're
Expert.
experts.
Yes. Yeah.
Expert mind, not beginner's mind.
Yeah.
Yeah.
So now, you know what? I don't care. I mean, I care about insulin to the extent where my patient is safe, right?
Hmm.
But I care about more their stories, right? I want to see why what's going on is going on, right? So I can, if somebody's sugar is like 300 or 400, I obviously am going to make sure they're getting the right amount of insulin. And once I built that, trust with them over a few months, they have come back to me for a few appointments. Then we'll start exploring about, what it is that they are doing in their daily lives. I use that 4-leaf questionnaire, which is, now adopted by American College of Lifestyle Medicine. So I make them write down how many, servings of vegetables they are having, how many servings of fruits, etc. they're having. And I mean, diabetes is diabetes in my office. I have a big poster, diabetes. So now I definitely talk about diet, and I don't ignore the elephant in the room anymore, which, back then it used to be always this medication, that medication, and The pink elephant in the room was never addressed. So that never happens now, and many times I'm not successful. Patients may not come to me in that stage of change, right? Those 5 stages of change, but it is always addressed. And patients adopt it to a certain degree, they don't. But I feel fulfilled at the end of the day that I've done the best job I could do.
Yes.
So, so Mahima, like besides diabetes, what are the common conditions that you see in your clinic?
So we see all hormonal disorders, all metabolic disorders. My specialty is thyroid. I've spent a lot of time in endocrinology doing thyroid, and that's a very critical gland or an endocrine organ in the human body, uh, located right up here in our neck. And I also specialize in women's reproductive disorders, specifically PCOS, a very common condition, polycystic ovary syndrome. It's actually the most common hormonal disorder in young reproductive aged women. Um, I'm afraid that diabetes will overtake that soon, that young reproductive aged women will now start getting diabetes pretty commonly too. But as of now, PCOS is up there.
Mhm.
Um, and then, all kinds of endocrine disorders. Thyroid nodules are a specialty of mine, hypothyroidism, uh, reproductive disorders in men, specifically, male hypogonadism. Um, and then, the very rarely encountered adrenal disorders, pituitary disorders, and so on.
So our audience is all ears about it because they do want to know like what causes thyroid disorder. So we do have some people who are experiencing hypothyroidism, and at the same time they're getting conflicting information from their doctors. Like we say something, and then they go to their specialist, they hear something else.
Yeah.
So we thought it would be a good idea, like if you could just educate us on like what do you think causes hypothyroidism?
So, hypothyroidism can be caused by many conditions. Worldwide, the number one reason for hypothyroidism is iodine deficiency. Fortunately, in the US, we don't have so much iodine deficiency because our salt is iodized. So, and I think in Canada also, they don't have a lot of iodine deficiency. Generally, in North America, the soil topography might be that, we have plenty of iodine. Um, in North America, I believe, the number one cause is Hashimoto's thyroiditis, which is named after, a young guy. He was like, I think 30 when he described this condition more than 100 years ago. And so what that means is it's an autoimmune disorder. The word auto means self, and immune is our immune system. So, when our immune system starts attacking, normally the immune system, the job of the immune system is to attack, foreign infections like coronavirus or tuberculosis or, pneumonia and stuff. But if it becomes dysregulated, or if it malfunctions and it starts attacking its own self or its own body, that's when we get autoimmune conditions. And Hashimoto's thyroiditis is a very common immune condition where the thyroid gland gets attacked and it stops functioning properly, and the thyroid hormone, which is the chemical that the gland makes in order to regulate our metabolism, those levels go down because the thyroid gland is inflamed and damaged. So what causes this autoimmune condition? And those are again many causes, like stress, poor lifestyles, hormonal changes. So, very common in girls, 10 to 15 times more common in women than men. And around the time of puberty or pregnancy, postpartum, or menopause. These are the four stages of a woman's life when there are big hormonal changes in their estrogen, right? At that time, it is very easy to precipitate Hashimoto's thyroiditis, especially if somebody's lifestyle or stress levels are, affected at that time. So, when we have all of these maladaptive sort of factors at play, that can trigger it. And also a big component of it is genetic. So, if you have first degree relatives, if your parents or your siblings have it, there's a higher risk for you to get it than the general population. So if you've inherited the genes, and if there is a big life stressor in your life, some viruses can trigger it also. And if you have a hormonal change, all of these things can trigger autoimmunity, and that holds true for many autoimmune disorders, not just Hashimoto's.
So how much of among all of this, like genetic component is not something that we can do much like. So
Mhm.
it is something that. So how much of it is lifestyle in your practice that you see? Do you see like where you have patients with hypothyroidism or Hashimoto's, and when you change diet and lifestyle, that they start to improve? And if you do that, what sort of lifestyle measures do you suggest?
So how much of it is lifestyle? We don't know. We don't do the studies yet to know exactly how much of this is lifestyle related. But the truth is, way back when, like just if you go only 1 to 2 generations, even one generation ago, we didn't have like this epidemic of everybody having thyroid. Now, if you look at especially South Asians, us Indians, every fifth or sixth person they've got a thyroid disorder, right? Everybody's taking thyroid pills. Back in those ages, that was not so common. So
Hmm.
I believe a lot of this is our modern civilization lifestyles. We don't have very good studies, like population studies that tell us exactly how much of it is attributable to lifestyle. Now, in terms of what I do in my practice, most of the, unfortunately, because I'm a specialist, most of the patients that come to me are already the ones who have been suffering for a long time. And the same goes for diabetes. Patients are not referred to me at the time of diagnosis. They are referred to me when they have, had symptoms for many years, and then they are like, okay, now we can send you to a specialist because you're not, deriving benefit by just being with your own primary care physician. And by the time they come to me, I think, most of them are on full dose levothyroxine. So what I do is basically, many times even then they're not feeling that great. And that we think is because of the thyroid antibodies in their blood, that, just the fact that they have autoimmunity tends to cause these symptoms like joint pains or muscle pains or fatigue or, lack of vitality, or, feeling like their brain is fogged a lot more and they are not able to concentrate and so on, right? So all of these things, if we just sanitize their lifestyle, they feel better than they have felt in years.
Hmm.
We changed, the number one thing to go out is ultra processed foods, anything sugary, anything that will cause their, sugars to spike, etc. And, trying to get them to as much of a whole foods plant-based diet as we can. And then, many people, they have their unique triggers. Some people may not do very well with soy. Some people may not do very well with gluten, etc. So we work on their individual triggers or their things that they are sensitive to. So we do gradually, we work on them gradually, but most people will improve with just basic, stress management, diet management, making sure they're getting plenty of exercise and just living anti-inflammatory lifestyle.
This is so profound because most of the time, like in our clinical practice, like with the 10-15 minute appointments that we have with patients, like you don't get all the time to discuss all this, talking about the diet you mentioned, about the stress, and like sanitizing the lifestyle. It's great that your patients are able to find you and you're able to do that. You mentioned that sometimes the patients come to you, most of the time they're coming at an advanced stage. So let's say if someone is freshly diagnosed, like a first year or second year or third year of hypothyroidism diagnosis, so do you see that they have a better chance of reducing their medications, or even reversing, like arresting the disease, if they institute these lifestyle measures at an earlier stage?
So, we don't have a lot of data on that. What you're talking about is when they have mild hypothyroidism or subclinical hypothyroidism, where, their TSH levels are less than 10. They're just a little above, so their TSH is, 6 or 4. And just for the record, the TSH normally should be less than 4 or 4.5, depending on which lab we go to. So if they have very mild hypothyroidism, we could work on that, with obviously, we have to be careful about, if I can say that, oh yeah, they can easily, avoid medication, right? However, I think, If they begin with mild, there is a chance we could get the inflammation under control and be able to hopefully avoid levothyroxine for some time. But if they begin with a TSH that's very high, above 10, then we should do levothyroxine, which is the medication that we use to treat thyroid disorders. But yeah, unfortunately, the data on that is not, it's up and coming. There's not a
Yes.
lot that we know about, the
Yes.
reversal of hypothyroidism.
Yeah.
Yeah.
What we have observed in our like gift of health programs is like we are teaching people how to adopt a plant-based lifestyle, and then we also we talk about stress management and increasing activity. But the core component is switching to a whole food plant-based lifestyle. We had at least like in last 3 years, like three students who finished the program who were on this levothyroxine for a hypothyroidism for a long time,
Uh-huh.
and their doses were had to be reduced by like 50 to 75% within
Wow.
within 6 to 8 months.
Wow.
So yeah, so that's I mean we haven't seen a whole lot of data, but like
So
uh,
anecdotally, I think that does make sense. You're right. I don't have any doubts that, if somebody really manage their lifestyle, if they are, like just had a baby and their TSH went up because of the resurgence in immune system after delivery, and their TSH is 7 and they decide to, really go on a good diet, why they would have to, ever start levothyroxine. They might actually be able to get back to baseline within a few months. And converse is also true. If they don't take care of their lifestyle at that stage, their TSH may progress. So, and in terms of, you're being able to get the dose down, I think that's also very, very, very scientifically plausible, because, their weight will go down. So their metabolic requirements for levothyroxine will go down. And there is another hormone called TBG, the thyroid, not hormone, but a protein called thyroxine binding globulin, which actually binds the T4, the levothyroxine. So when we become more insulin sensitive, there is a chance that that hormone might, change in a way that the dose of levothyroxine requirement might actually go down.
mm,
So yeah, I think it is scientifically very plausible. I just want people to study this, but more importantly, patients feel well, right? Because nobody
yeah,
minds taking a tablet every morning. That's not the point.
yeah,
Yeah, it's not like insulin injections. What people don't like it is having the symptoms of hypothyroidism, that they
hmm,
are more tired, they're gaining weight, they are not able to concentrate, they have aches and pains, and those go away within a few weeks. So I think that is what the whole point is, that
yes.
they
The,
are
the the
feeling
whole
better.
point is like upgrading the quality of life, and
Right, right.
when to be able to do that with medications and without medications, are combining both of them, it's
Exactly.
yes, and then yeah, beautiful, yeah.
Yeah, like we also had a few participants who had thyroid nodules, and especially when they learned about this lifestyle, so they were surprised that certain foods might contribute, because they had no clue that the foods that we are eating currently might even contribute to. Because when they were going to their doctor to the doctor even did not tell them. So it comes as quite a shock for many of them that food can cause. So, like, can you, for our listeners, can you just list down, like, what are the common foods that we see in our environment nowadays can contribute uh, to
Uh,
thyroid nodules or even
So,
imbalance?
so thyroid nodules, they're basically a growth of cells, an abnormal growth of cells in your thyroid. They kind of, the way I explain it to my patients is, it's kind of like having a mole on your skin. It's a growth of cells, except that it's inside your thyroid. And most of these are benign, but sometimes they can get very, very large and become kind of a nuisance, more to speak. Like they are sticking in your throat, or they're having a difficulty swallowing. Very rarely, they can also overproduce thyroid hormone, and a person can become hyperthyroid, which itself is a problem, because if you have an imbalance of hormones, if your thyroid hormone levels are too high, then that can cause people to feel sick too, because they will have a very high metabolism, not able to sleep, heart will have palpitations, may even get, arrhythmias or tachycardias, etc., which is abnormal heart rate or rhythm. So thyroid nodules, they can form, mostly these are, genetic or environmental, there are some endocrine disrupting chemicals. In terms of the food and other exposures, the big one that comes to my mind is iodine deficiency. Goiters are very notably like before we had iodized salt, we would have large goiters, and there would be serious repercussions on children's intellectual ability and IQ if they were born to women who had iodine deficiency. Um, so iodine deficiency is a big culprit for nodular goiters. The other things that can make thyroid nodules grow is obesity, alcohol, smoking. I think I already mentioned the endocrine disrupting chemicals. We don't have full control over them, and there is not a lot of randomized control trials that see how we can eliminate these. But just in general, phthalates, PVCs, BPA, etc., plastics, microwaving plastics, all of these, so these are some of the things that we should be mindful of, things that we can control. So maintaining a healthy BMI, not drinking excessively, for women, ideally less than 2 to 4 a week at the most, because women are the ones who have, 10 times more nodules than men do. And then, smoking, obviously, we should make sure we quit smoking if that's a problem. In terms of other food culprits, not a lot we know about cruciferous vegetables, although we hear about, them all the time. And, media say, oh, I can't eat cruciferous, I can't eat cabbage because that can cause a goiter or a nodule. And that is not totally true. The studies show that you can have cruciferous vegetables in moderation. If you want to eat like a serving or two daily, that should be okay. The concern comes from a chemical called isothiocyanate, which is supposed to, prevent the uptake of iodine into your thyroid cells and let you form thyroid hormone. But, if we consume them in the regular, like one serving or two servings, which is hardly like 2 cups of raw cabbage or broccoli, right? Then that much is not clinically enough to cause, the inhibition of iodine uptake. In fact, the people that consume the most cruciferous vegetables in the world, the East Asian countries, especially Japan, what they do? They actually consume their bok choy, etc., with like sea vegetables, right? So they'll have their kelp and their, dulce, etc., with their, those will be in their salads or soups. So those sea vegetables are very rich in iodine. So if you're getting those cruciferous vegetables, you're getting the iodine, so you won't have the deficiency of iodine that causes the, the nodule formation. And you won't have the excess of iodine because the cruciferous is, going to prevent the excessive iodine getting into your thyroid, because iodine excess is also a problem. I'll, talk about that later. And so we don't have to be too much afraid of cruciferous vegetables. Of course, we don't want to eat or drink like gallons and gallons of kale smoothies every day, because then that might, get to a point where we are talking about goitrogens. And the third thing that people worry about a lot is soy, which is, again, one can eat a serving of soy a day, at least, maybe even 2 servings a day. And that, even if you have thyroid disorders, it doesn't matter. The risk for that comes from the story about that comes from, isoflavones, which are a chemical that inhibit one of the thyroid peroxidase enzyme that, again, is important for our thyroid hormone formation. But again, in order to do that clinically, you have to eat tons and tons of soy. So if you're eating like 1 cup or 2 cups of soy a day, that itself should not be enough to cause thyroid problems. Especially unprocessed soy. I don't want people to go and start eating like these highly chemically processed soy. Any processed food, soy is no exception. But if it is healthy soy, like, edamame or miso or, like just soybeans cooked, that should not be goitrogenic if eaten in moderation. And I don't want people to feel, oh, I have thyroid disease, I cannot eat soy. Unless, of course, if you're allergic to soy or if you have some other sensitivity. And again, if you're taking thyroid hormone already, then you're getting thyroid hormone. Then you don't need thyroid hormone to be produced by your gland that much, right? So again, there is no reason to worry about soy in that case. And I feel like I'm talking too much, but I'll say one last thing about selenium, which is another mineral that we must make sure we have plenty. Selenium is the most critical element for our thyroid, for actually our immune health also, right? And our cardiovascular health also. But thyroid is one of the richest organs in terms of selenium consumption. And so there is a very important antioxidant enzyme inside the thyroid that needs selenium as a cofactor. And if we have selenium deficiency, then we won't be able to, again, make our thyroid cells withstand the oxidative damage. So selenium is richly found in Brazil nuts, cashews, mushrooms, I think to some extent also in beans and pumpkin seeds, etc. So we must make sure we take a variety of these selenium-rich foods in order to make sure that we're getting plenty of selenium. I tell my patients with thyroid disorders to make sure they get mushrooms at least 2 or 3 times a week. Mushrooms are the bomb when it comes to thyroid.
Another good reason to eat mushrooms, like, so they're so protective against even breast cancer as well.
Yes. Like I'm so glad you brought this up, Mahima, because like some of our participants, like we're wondering, like because the doctors have told them to avoid soy, like if they're suffering with thyroid disorder. So I'm glad like you cleared the myth about soy and cruciferous vegetables.
So it's
in moderation,
okay.
they should be okay. I don't want them to drink gallons and gallons of soy milk, because then we are starting to get to the point where we can get clinical goitrous effects. But 1 or 2 servings a day, you're talking about like,
Yeah.
10 to 16, or who eats 16 ounces of soy? It's kind of hard to do that, right?
Yes.
And if
Yes.
you should be okay. You should be safe to do that.
Yes. Yes.
So basically, it's okay to have 1 to 2 servings of cruciferous vegetables like cabbage, broccoli, bok choy. This is all good. So much of anti-inflammatory stuff
And they're anti-cancer, cruciferous
anti-cancers.
vegetables.
So, and sometimes we see people avoiding this like kale and with limited information. So it's good that we are able to clarify that. And same thing with the unprocessed or minimally processed soy. They're one of the most helpful foods on the planet.
Right.
So
With the
and
soy, they want to keep it non-GMO also. So organic, hopefully, it's non-GMO, but just stay away from GMO soy because I worry about them.
Yes.
So I want to go back to the discussion on hypothyroidism we had. For our listeners, we want to simplify as much as we can. What is that they could do, like in terms of, like even the lifestyle measures or sanitizing their lifestyle. You mentioned the whole food, plant-based lifestyle.
Uh-huh.
So, and that means we are talking about increasing the intake of whole grains, beans, fruits, and vegetables, and then avoiding or minimizing the dairy products and the animal products and the processed foods, right? And then lifestyle measures, managing stress and being active. And you also mentioned like maintaining a healthy weight, and and there was another good reason for avoiding smoking and alcohol. So sometimes when we share these things, people say this is common sense, but the thing is, when we take care of these things, most of us will go, and when our patients do this part, we can pretty much go out of job, right? 80 to 90% of what we see is lifestyle.
Exactly.
Yeah. So
smoking actually, is one of the biggest culprits for that ophthalmopathy. The thyroid, Graves' disease, the scary pictures we used to see when we were medical students. Remember?
Yes.
That the eyes are, and there are patients who they cannot quit smoking even if their lungs are like shot. But when they see the eyes, they're like the picture. They're like, okay, I'm not gonna smoke because I don't want to have the eyes like that. But ophthalmopathy in severe cases can lead to blindness. And smoking is the number one. Tobacco is the number one culprit. There, if somebody smokes with Graves' disease, I tell them, listen, this is serious. Your eyes can get, really affected at any time. Same thing with, there used to be a very rare condition called pretibial myxedema.
Yes.
It was, when the shins, especially the lower legs, they would get this swelling or this, rash of, like really red colored sort of fatty infiltration in the legs. Very high risk with tobacco. And these are all thyroid related. So sometimes, again, if we need more reasons to quit smoking.
Those are definitely good reasons. Yeah. So we have some participants in our group like who have been diagnosed with PCOS. So they're wondering what are the things that they can do, like what lifestyle changes or what measures might help their condition.
So could you also, briefly for our listeners, just explain, like, what is this PCOS
PCOS.
and how
Absolutely.
is the lifestyle connected?
Yeah.
So PCOS or polycystic ovary syndrome is, like I said, the most common hormonal disorder in young reproductive aged women. And what it means essentially is that a woman has irregular menstrual cycles or irregular ovulation, right? So a woman typically should have, a young woman should have a regular menstrual cycle. We used to say it's connected with the lunar cycle. So, 27, 28 day, but anywhere from 21 to 35 days, whatever is that woman's, cyclicity. But in this case, women may not have a menstrual cycle for many months or even years, right? And the other problem that they have here is excessive male sex hormone or androgens in their blood, which we can measure on a blood test, or they have symptoms from it, like they may have hirsutism or facial or body hair, unwanted body hair, or they may have male pattern hair loss from the temples, or they may have acne, like pustular acne. So all of those can be signs of like androgen excess or male sex hormone excess in a woman's body. And those two are hallmarks of PCOS. It's called PCO or polycystic because there are very frequently, although not always, tiny cysts, like really small, multiple cysts on both the ovaries. And what causes this condition is very complex, but to make it short, it's insulin resistance, or what we keep hearing, metabolic syndrome, right? So in these women, they have a genetic predisposition where their body is very resistant to insulin, and what that means is a certain amount of insulin is present in the blood, but the cells, the muscle cells, the liver cells, are not responding to that insulin, and they are insulin is saying to the cells, okay, get the glucose in, but basically the receptors are not opening up and not letting the glucose get in. So these women may have impaired glucose tolerance, or they may have slightly high sugars, right? And this condition is very, very environmentally controlled. It's a genetically inherited, but environmentally and also controlled by metabolic factors, nutritional factors, toxin exposure, and so on. But as is the case with insulin resistance, the lifestyle controls it, or really determines how it will get manifested. So I'll tell you a case in my practice. This is an actual patient in my practice who had come to me in her early 30s, and she had had one child. So in her late 20s, she may have been diagnosed with PCOS, and her body weight after her first pregnant, she couldn't get pregnant. She had required fertility drugs that did not work out, and then she underwent in vitro fertilization, and with that, with the second one, she was lucky and she was able to have a child. But when she came to me, she had been 268 pounds, and her testosterone level, which is the male sex hormone that we were talking about, was quite high. It was 51, and in a normal woman it should typically be 6 to 45, but most women are less than 25. And we repeated it was still high, 79 or 80. So she we began her on metformin, which is the drug we use for PCOS, to sensitize their body to the insulin. But she also did lifestyle changes. So she stopped eating processed foods. She stopped eating all the white flours, white breads, etc. And she went on a good, like a decent exercise program, just 30 minutes of regular exercise, nothing crazy. And she, within 1 year, her body weight was down to 180 pounds. So she lost 80, 90 pounds. And her, testosterone went down to 17. Now, before she started this, her insulin levels were 7.9. And we say, anything above 8 is a high fasting insulin. And her glucose, was okay, 87, but, with that high fasting insulin. So she had insulin resistance. And now her insulin went down to 2.9, and her sugar is down to 78. So her insulin resistance score is now 0.6, which is extremely insulin sensitive.
That's amazing.
And the most important thing is she got pregnant on her own, right?
Yes.
She
That's
did not
amazing.
need
Yeah.
the drugs this time or the in vitro this time. And PCOS is one of the most common and one of the most easily treatable causes of women's infertility. It's actually quite, I think it's an epidemic in India right now, the
It
amount
is.
of infertility in young women. So just, obviously we gave her metformin, but like you said, Arjun, it's, a co-drug. And I think, just metformin could not have explained the 90-pound weight loss. She did
Yeah.
her due diligence. She did her hard
Mhm.
work, and she was able to have a successful pregnancy. And, she was on drugs to control her acne before. It's a drug called spironolactone. And she came off of it. Her skin is fantastic because her testosterone levels are now normal. So this is what lifestyle can do in many cases.
I'm
Yes.
so glad you brought this up, Mahima, because we had a similar participant in the course. And the first words that she spoke to me, she said, like, I wish I can be a mother. Like on the first day of workshops, she was literally in tears and she said, I wish I can be a mother. And through the 3-day workshops, she learned about the lifestyle changes and she implemented that. And actually, 1.5 year later, we came to know that she was pregnant, and
Yeah.
we were so overjoyed for her. Like
Yeah.
by, as you said, by changing the lifestyle measures, and like by reducing her weight and eating healthy, going for a whole food plant-based diet, she was able to like take care of that condition.
Yes. Well, actually, I don't want to come across. I feel like I'm making, weight a big central portion of my story. So even 5% weight loss, we have done studies. There are numerous studies. PCOS, thank God, it's like the lifestyle studies are there, unlike thyroid,
Mm.
because there's a lot that we have studied, meta-analyses and systematic reviews on women with PCOS. And, studies show that 5% weight loss can lead to
Mhm.
regularization of menstruation and pregnancy outcomes.
Mhm.
So people don't have to feel like they have to lose a huge amount in order to be able to get pregnant. Just a modest amount is, 10, 15 pounds if they are looking at like, somebody who's above 200, 250 pounds, or even less than that. Anything healthy, anything that moves you in the, the healthier direction, it can actually bring back fertility very easily.
That's so good to know because most of the time, many of our patients think like, they have to have perfect health rather than just moving towards the being the healthiest version of themselves. Just 5 to 10%, even 5% of weight loss is good for PCOS. Similarly, for even in type 2 diabetes that we
Diabetes,
see,
absolutely.
yeah,
Yeah,
just
the direction is more important than the speed.
Yeah.
yes, yes, direction is
You know,
yeah.
because you don't want to be going backward.
Yes,
Yeah.
yes,
And
and sometimes many of our students that we work with or patients, they want results happen now. Like you mentioned, the direction is more important than the speed. So that's when we come back to the mindset. Hey, when we start making these changes, the results will happen. So
and
uh,
that's actually very important for fertility, because women, when they start doing, oh my god, I have to track my ovulation, I have to be on a, we have to be on a calendar here, and when you do that, that's when it becomes a problem. Stress is a big important issue for fertility. And
mm,
when you are just laid back and you're like, relax and you enjoy, you know that the joy is more than what you're giving up, that's when pregnancies happen, right? So stress is big for fertility. So the last person I want stressed out is somebody who's trying to have a baby. They should not stress it.
Yes. So, so good. So wonderful, Mahima. We have one question from our listeners. So, like, are there any natural options for endometriosis?
So endometriosis is poorly understood. Natural options, I would, other than whole food plant-based diet, I think there are some supplements that they talk about with at least PCOS, like inositol or resveratrol, even omega-3 fatty acids. But again, I don't think there's a lot of good quality studies. In terms of the 6 pillars, though, if they are eating a healthy, well balanced diet, and a very easy way to do that, to check off all the micronutrients, is the daily dozen, Dr. Greger's daily dozen, so that they're getting, their flaxseed, and they're getting their omega 3s. Omega-3s are actually huge for all, women's reproductive issues. And, there are trace minerals like manganese and zinc. Zinc is actually very important for men's reproductive function also, because, the seminal vesicle fluid actually it has a lot of zinc in it. So if they have enough of micronutrients through their diet, I don't know if they need a lot more, natural sort of supplements on top of that. All of these, they don't have a lot of data, but vitamin B12, vitamin D3, omega-3s.
Yeah, it actually, like, this question is for people like who are not still into plant-based eating, but they're looking for information. So, like, as you mentioned, it would be definitely a good idea to transition to healthy lifestyle.
Absolutely. Once
Which we're
you're
talking
doing that,
about.
yeah. I'm sorry, go ahead.
Go ahead, yeah.
I said once you're doing the 6 pillars, and I'll just, enumerate the 6 pillars again, which is the number 1 is the plant predominant diet, and whole foods as much as you can, very limited processed foods, especially, ultra processed foods like, sodas and, candies. Those should be out unless on a very, very special occasion. So that's the first pillar. The second pillar is exercise. And exercise, again, at least in women with PCOS and even with endometriosis, because they are in, they typically tend to have excruciating pain. For some women, vigorous intensity exercise, or a high intensity for like just 15 minutes or less can actually give a lot of bang for the buck. But if you don't want to do that, just making sure that you move around, don't sit for longer than 20 minutes. Sedentary lifestyle can absolutely cause problems for everything, including fertility. Number 3 pillar is sleep, which is huge, which is the thing that we never talk about. It is the most underrated pillar. But all of this circadian misalignment, staying up till late at night on screens, or not getting adequate rest, trying to get by on 5 hours or less of sleep with caffeine, that is very detrimental. And one of the big things with sleep is it directly affects our hypothalamic, the gonadotropin RH, the releasing hormone production. So you're not going to have that. So what I'm trying to say here is the brain and the pituitary, they control the ovarian egg production, right? And in men also, they control the testosterone production. And if we don't get enough sleep and there's too much cortisol in the in the body, that will prevent us from having those rhythms or those pulses that we need in order to make our ovaries and testes have make eggs and sperm and testosterone and so on. So having lack of sleep can directly impair our fertility in both men and women. So all of this lifestyle, you're going from one time zone to the other, and always running jet setter. There's actually a study that shows that women who work more than 32 hours may take a longer time to conceive with the fertility treatments than women who work 10 to 32 hours. And that might be, not saying that we should not work, but make sure that you are not compromising on other aspects of health. And the 4th pillar is stress management, and I already said that's huge. 5th pillar is not doing any of those risky substances like excessive alcohol, tobacco. Tobacco can actually deplete your ovarian egg production, and it can make your ovaries age. It can make a young 25-year-old girl have the reproductive health of a 50-year-old lady. So that's a bad idea. Like, it can age all the body cells, right? Ovarian cells are particularly susceptible.
Basically frying your ovaries with smoke.
Exactly. That's a good way to think about it. I didn't think that. And last but most important, my favorite pillar is relationships. Making sure that you're in positive, nurturing relationships and not in toxic, unsupportive situations. So don't isolate yourself. Don't be lonely. Those are one of the biggest pillars that can affect our inflammation and our health. And those apply for endometriosis as much as they do for any other women's reproductive disorder.
You just hit the golden nuggets, Mahima. And as a woman, it's so common. Like, as you said, like, better to avoid harmful substances, like sleep on time, like, because we try to take care of everything else. And also, like, having positive relationships. So, like, I mean, you just hit the gold mine, and this are so, I mean, like our listeners are so happy to like get all this wonderful information from you. So one last question that we got here is, what about the premenstrual disorder? Like if a person is experiencing on a very common basis, so is there something that they can do about it?
So, one of the biggest cures for the PMDD is exercise, especially outdoors. And that the PMDD, it happens, it's premenstrual dysphoric disorder, which is that women, because of the increase in progesterone in the second half of their menstrual cycle, they can be susceptible to depressive thoughts at that time. So exercising, especially outside in the nature, can really really help with that that the so-called antidepressant effect that they may need. And that holds true for any women who are suffering from depression, whether it's PMDD or not. Exercise is the single most underutilized antidepressant.
Yes.
Same thing with foods. Like I have seen so many women will get real depression and anxiety symptoms with especially ultra processed foods that cause sugar spikes. Dairy is a big one. Excessive, like high fat cheeses, or dairy in general, because of the content of hormones and antibiotics and chemicals, etc. And the same thing with any meats, red meats, processed meats. So those can really affect the way that the blood sugar surges occur, and how your brain feels or your mood feels. And of course, mindfulness is a big way to deal with PMDD.
He wants to join.
Yes.
I'm sorry about that.
It's okay.
And in terms of the positive foods, I think, again, making sure that we are doing the whole food plant-based diet, and, we are getting all of our micronutrients. But the good ones are, green leafy vegetables. Whole grains are supposed to be very good for, young women in all stages of their reproductive life. Especially so for pregnant and lactating women. In fact, lactating women, there are multiple studies that show that whole grains actually help increase their milk production. It's a positive galactagogue. But for PMDD, the foods that can help with their moods are walnuts, or chia seeds, anything unprocessed and healthy, green leafies, etc., etc. Those should all help with PMDD. So exercise, food, mindfulness. There are studies on mindfulness in people's metabolic health, and also PMDD.
So sometimes when we mention this to our patients or clients, like you gotta fix your food, you gotta take care of your stress, you have to do exercise. They feel overwhelming. So in your clinic, like what's your approach? Do you start with one thing and then build upon something, or like how do you approach with this? Trying to do the 6 pillars.
So I am not as great a coach as you guys are. It will take me a lot more time to unravel my step back from my expert, because I'm so-called specialist, right? So I think I'm an expert. So like I said, right, I thought that I know better than Dr. Frades does. But I think one has to think of it as a coach, right? The coach approach, where you are not doing the thing for the patient. You're just looking at what they are doing and how you can help. You're not playing the game, you're not this player, you're just their coach, and your job is to support them so that they can bring out their best game. And what is their strength? So first step is to see if they want to change, where they are in change. If they don't want to give up their cigarettes, and they are absolutely not in that stage, no matter how much you advise, it will not happen, right? So that's number one. And number two is, I also have the same 15 minutes. So I try to, change one thing at a time, noticing what is it that they have that is really the number one priority. So for PMDD, if you were going to take one advice, no matter how bad you feel, and, I know how, it can feel when you have depression. It can feel like, you don't want to do anything, no matter how bad you feel, please go out and take a walk or go for a jog, or just no matter what it feels like, and within 10 minutes of the walk you will feel like, okay, I'm starting to feel a lot better. It's like, Beth Frietes used to say, not used to, she still says that her motto is, if you have a headache, take an aspirin. If you're stressed out, if you have the blues, or you can call it PMDD, she didn't say that, but if you have PMDD, go for a walk. It's as simple as, it's kind of like I'm giving you a pill. Just go and do this if you're feeling like that, or go do dancing or something that makes you, move and just circulates your blood. And then after 20-30 minutes, tell me, how do you feel? So that would be my one approach for that person. If it is somebody else who's got something else, we'll work on that pillar. It has to be really tailored to that person who's sitting in with you, and what
Yes.
they can do in their limited time, because people don't have time, they're working 2 jobs. So one also has to be mindful of what they can change in their limited um, resources, and work with that.
Yes, that's a very helpful advice. Like, so basically we are going a graded, like you start with one thing and then you're building upon the other stuff. Because sometimes when we say, hey, these are the 6 pillars you have to work on, I'm like, okay, nice knowing, interesting, but I can't do all of it.
Yes,
So
yeah.
we just start with like maybe either a food or exercise. And once we start doing one thing, it just kind of like a keystone habit kind of thing. The ball starts rolling, and then other habits just we keep on building from that.
And it's a lifelong pursuit. I have never met a perfect person. There is nobody who's doing all the 6 and become God. That hasn't happened. And I think a good way to motivate patients is to humanize yourself too. If you are telling them, oh, I'm in the same boat, and just have that friendly conversation with them where they feel like they can open up with you.
Mhm.
And I think that's where the magic starts to happen, where they want to share it, what it is with you. So if you come to them as an expert, oh, I know better than you do about your life, that never flies. But if you approach them like, you are learning with them, and you want to explore this journey together, and you want to walk with them, I think then they are going to open up.
That's beautiful. Yes.
So
Well,
yeah, you have put all those things so beautifully, Mahima, and like we are really, I mean, actually, like a lot of listeners are really thanking you, and they're so excited that they were able to attend this session today, and really thank you for.
yeah, thank you for taking this time and answering these questions, clarifying some myths, and this is so helpful. Not just that, and bringing your humanness and bringing your story into it. And we had like comments here, like people loved your story. Your solution for like burnout is engagement. Like we have comments here.
But that's what they describe in literature, right? I mean, that's what they say, the antidote to physician burnout is physician engagement. Because stress is there everywhere, but once you have a reason and a meaning to do what you're doing, then the stress will take care of itself. And so, yeah, it was fun to know that that's that journey, and I'm taking with you guys. You're saying I had the best time in the last 1 hour. Anytime I see you guys, it's it's, I feel very happy and blessed to learn from you guys.
Oh,
Thank you so
thank
much.
you. So we're gonna wrap this up. Thank you so much for joining. And for our listeners, like you are in Connecticut, right? You're working in
Yes,
Middlesex Hospital in Connecticut.
that's right.
And if you're going there, and um, but
Yeah.
you are also like they could find you on the plant-based doctors
Yes,
database.
yes, yes.
Yes.
And I'm on Twitter also, so please feel free to, if you have any questions, I can you know offer some kind of guidance. I'm not in Canada, so I won't be able to treat many of you, but if you have any questions, just tweet me, or feel free to find me on plantbaseddoctors.org.
Oh,
Yes.
thank you so much.
And some of our viewers are from US too,
Oh,
so they're
great.
really happy to know that, like, yeah, there is a doctor out there in US.
Yes.
There's a few of
Yes,
us. There's a
yes.
few of us. If they have that directory, they might find an endocrinologist who is practicing in their state. So, but yes, I am here if you have any questions.
That's
Thank you.
so,
Yeah.
thank you.
Thank you so
Thank
much,
you.
Mahima. Have a wonderful evening.
You too. Take care.